Okay, that's going. Can I have my Sharpie, please? And then Cindy, I'll have you around this side here. Hi guys, this is Charles. I'm one of the surgeons at the Animal Emergency Centre in Moorabbin, which is in Melbourne, Australia. And I have a case, honestly, that I used to do a lot more of, and I haven't done a lot of them in a while. This is a mast cell tumor that's sitting right here in a dog. And we're going to do a wide local excision. We're going to leave it open to heal by second intention. So this will be a good opportunity for you guys to see that deep antebrachial fascia and how we go ahead and remove it. So I'm just going to have Cindy externally rotate the leg for me. Can I get a lap sponge, please? I'll get my blade, please, when you get a chance. So basically what I'm doing here, I've not done any imaging, thank you, on the dog, but I'm just palpating to see where I can feel thickening. Around the tumor. Okay, so that's the tumor as I palpate it. All right, and so I need to go a couple of centimeters away from that to make sure that I'm getting a complete margin. And there is a structure that I'm going to run into and I'm going to have to excise, which is the cephalic vein. So if we hold off the vein like we would for a catheter, cephalic vein is running up just like this, and probably right about here. All right, and so I'm going to ligate those two vessels before I go ahead and cut them, hopefully, so that I don't run into a problem. Can I please get some 3.0 PDS? All right, so the other thing we're going to have to make sure we do is that we get that antebrachial fascia, which is going to act as our deep margin to tumor penetration.
So I dropped the debate here on the floor.
That's all right, I don't need one. No. Cindy got mad at me and threw an instrument. All right, so I'm just going to just carefully dissect around. I'm down to my antebrachial fascia, and that antebrachial fascia is going to be my deep margin to tumor penetration. I might switch sides with you, please, Cindy. Just make sure that you keep your head out of the way. All right, so all right. I assume that the stream is going. Haven't had any comments yet about anybody telling us that they're watching. All right, so now I'm down to that antebrachial fascia. Okay, so that's just kind of falling away there. All right, so There's my rat tooth forceps. Now the thing is that when you're getting the antebrachial fascia, as we dive down beneath the tumor, we have to actually dissect between the muscle bellies a little bit to make sure that we maintain continuity of that antebrachial fascia. So we don't want to create strips of antebrachial fascia. We want to have continuity of the antebrachial fascia deep to the tumor. So you can see how that's kind of diving down in between the muscle bellies. And just elevate that please for me and I'll go ahead and cauterize it. All right. It's interesting that we haven't gotten any comments on the live stream because normally we would have lots by now. So it makes me think that either the live stream isn't going through, and if it isn't, I will just get it off my little hard drive and publish it later. Can I please get a Gelpia retractor?
Should have some on the table.
That's fine. We could actually remove all of these muscles and you still wouldn't have any problem with function.
So we won't see any kind of obvious bleeding or anything.
No. I think that actually has stopped bleeding already. I will have a little look between the muscle bellies and make sure. Now what we're going to do is we'll get a hemostat. I'm going to grab onto that antebrachial fascia. We'll have Cindy lift that up. I'll be coming to cephalic vein in a minute. Let's see what's going on down here. So So there's the cephalic vein right there. So there's the cephalic vein, and we've got no issue whatsoever with ligating that. Thank you. I'll just use a needle. Thank you. And this is a vein, not an artery, so we don't need to transfix it. Okay. So now I'll just continue dissecting that away. And you have to make sure that you tell the pathologist that there is an antebrachial fascial layer, because they'll say, they sometimes will say, oh, the margins are 2 millimeters away from the tumor, but not recognizing that that antebrachial fascia is actually going to be a barrier. And so they sometimes will call an excision either close or incomplete, when in fact that fascia is really protecting us. Okay, I'll switch sides with you again. Come around the other way. All right, so we'll just lift that up here. I'll come around the other side. My head's in the way, thank you. Lift that up a little bit. Thank you. Here's the other side of that cephalic vein. Let's release that. I'm cutting through the antebrachial fascia there. And then we'll come around the top here. It's also possible that since I ligated the distal segment first, that there's no blood flow coming through the proximal segment. I think it's in that bundle right there. I think that's it. I don't need to tie the other one. Okay, so we can show what that looks like. So we've got nice fascia deep to the tumor, all the way through. Right, so that's going to be a nice clean margin. So now just look at our tumor bed. Make sure that there are no big bleeders. Okay, now I'm not going to make any attempt whatsoever to close this, so there's really nothing worth trying to close. I could bring that down a little bit. I really don't think it makes much difference on the speed of healing if you bring the edges in a bit, but I guess it will shrink. So my concern is that it'll also anchor the edges down when they're trying to heal back together. I guess it's possible that for some reason I have the chat turned off on the streamer.
Oh, can you actually turn that off?
I don't know. I didn't think I could, but... Can we get some bupivacaine, please? I don't think there's anything else really. Just about 6 mil. I did a bunch of changes to the actual channel with respect to the description and stuff like that. I wonder if I inadvertently pushed something that says that you can't chat. Okay, so now what we'll do is get some bandage material.
Yeah, already.
Is that all in here?
Yeah.
That's great, thanks. Can I please get the mallow in first? And once I put the malolin on, it'll be non-sterile. Like we can make it non-sterile. And then we'll take the tape off the bottom. Thank you. So we'll just put that malolin on there first. Hold on to that. And then I'll take some scissors, please. Thank you. Can I get some white tape, please? Yeah. Thank you. Just lay that down like that. We will zoom out. Like that, couple of pieces. Thank you. Nope. And then just a bunch of cast padding. So we put our stirrups on first. Probably need more cast padding than this. Thank you.
How many more rolls?
Probably 3. Get the big rolls. All right, so I'm going to wrap this snugly around the bottom so that then we can pull down on that without it falling off. Take our towel clamps off so we can get a little bit higher up. I am going up over the elbow. Okay, drop that down a little bit for me. So when you're doing a good bandage, you want tons of cast padding. I think that having a lot of cast padding is what makes a good bandage.
Oh, sorry. Oh,
Sorry?
yeah, I get it.
It's a little scratch. And some, can you get the bigger stuff of that? Might as well get the big vet wrap as well.
Yeah.
Thank you. So see how thick we're making it? Snug and thick with cast padding. So it's also going to protect us from creating a tourniquet effect with the conforming and vet wrap. So we're just waiting for the big conforming now. Okay, so it's failed on the uploads here.
Is it because of internet?
No, because we've got the right internet speed, so I'll have to work out what's going on with that. That explains it, but I can just upload it later.
Yeah.
All right, so then we put our conforming on. There's a cephalic vein right there. See it? And you definitely want to tie those off, because otherwise what will happen is that you'll get strike through on the bandage, and then you'll have to change the bandage in the middle of the night, or the owners will have to go to emergency. All right, so then we bring our stirrups up and finish up with our vet wrap. And a good bandage is a nice looking bandage. If it's messy, you have risk of creating tourniquet effects and all kinds of potentially disastrous issues. Get that white tape. Yep. Yep. So I've left the digits out like that so we can see, make sure that the toes are touching. So those are the two toenails there. And so if the toes separate, that's an indicator that we've got swelling. And the owners are instructed that if the toes separate, that they need to get that bandage off. And I'd rather them take the bandage off at home and leave it completely open than leaving a bad bandage on. So, all right, so we'll go ahead and wrap that up. Thank you very much for watching. Sorry it wasn't a live stream, but we will load it up later on this afternoon.